Well, I appreciate the opportunity to spend some time with you this morning talking about medical management services. And, you know, Tom kind of alluded to it as well. It's been around a long time, about 30 years, so it probably doesn't sound like, you know, a sexy topic. She's going to talk about pre-cert and case management and that kind of thing. But, you know, and in a lot of ways it has been kind of a commoditized product. But it's still a very, very effective product in terms of finding early on about that someone's been in a catastrophic situation or has the onset of a complex condition and so forth. So it really is the early alert to find out that there is a situation going on that we want to get our nurses involved in helping to manage that case and helping that family, you know, through that situation. But with that said, are all medical management programs the same? Are they all created equally? Is it, you know, here's the cookie cutter of what a medical management program should look like, and there's no, you know, there's no flexibility, there's no choices, there's no way to make it more impactful? Not at all. That's not at all the case. And in fact, it was exactly a year ago right now that Holly Weisky and I were kind of standing in the back of the room kind of chatting about if we could build the most effective medical management program and really kind of steer our clients towards the type of program that we know can really make a huge difference, what would that look like? And so that's a pretty fun task to kind of take on, and something that Holly and I and Tom and Marcia and others at Cypress really kind of went down that road of building out what we think would be the best medical management project or product. And that was really kind of the dawn of what we're calling the Cypress Medical Administrators Best Practice Bundle. And so that's what we're going to spend some time talking about today. Before we move into that, I just want to kind of get everyone on the same page if you're not familiar with who American Health Holding is. We are a standalone medical management company. We've been around about 20 years, headquartered out of Columbus, Ohio. Really started out doing pre-cert and case management, and then have continued to evolve into a company that really, I think, kind of falls into three main areas. We're a medical management, wellness, and cost containment company. And those three areas really fall into the bundle that we're going to talk about today. We are UREC accredited. That's kind of the good housekeeping stamp of approval for medical management companies, as you probably know. Very much a national company. We have nurses in about 39 states. We have customers in all 50 states, and in total have about 2 million lives that we are providing services for. In terms of our services, I told you we kind of, you know, really pride ourselves on having a really integrated product, very comprehensive, and really out there to meet the needs of all members, no matter where they're at in that healthcare spectrum. Are they someone who's taking pretty good care of themselves and we want to keep them there? Are they someone that's going through a current kind of catastrophic situation that we can help with? Or are they someone that has a chronic condition and are going to need our assistance in living a long and healthy life with that condition? And so we've really tried to put together a suite of products to address all of those different needs. And there's kind of a long laundry list here. One product that we've been selling for about 3 years now is the 24/7 physician consultation product through Consult a Doctor. And in fact, hats off to Cypress, because they were our very first TPA to get out and start marketing and selling that product, and have had great success with that. Getting into a lot of other things too, we have medical evacuation services. We have the ability to do outside independent external reviews. Lots and lots of services. But again, we're going to focus primarily today on our utilization management, case management, and some other cost containment types of programs. If you can have the right components and everything kind of firing on all cylinders, you really can have a really impactful program that can really help your members and help to keep those claim costs down. And that's really what we're attempting to do with this bundle, and I think are having some great success with it already. So if you look at kind of the little I guess, illustration that we put together here, starting on the outside of the circle, you can see that the main components that we're using, again, are utilization management, case management, and disease management. But then we really sat down and said, what are the main areas that are probably keeping you up at night? When you're looking at your check register of all the funds coming out of your claim account, you know, what are those areas that are really hitting you the hardest? And so that is really the focus that we use then in building this package. So starting out at the top, transplant. Transplants are extremely expensive, as you all know. They don't come along every day, but when they do, they're very expensive. And you need someone that's really focused and has expertise to manage those. Mental health. Sure. There have been a lot of changes in mental health over the last couple of years. And so we have resources in place to be able to address those needs. Oncology. We do more oncology case management than any other type of case. They're probably the most complicated, complex cases to manage. Again, you need folks that really know how to manage those cases and are really an expert, not someone that's dabbling in that. Dialysis, growing area of concern, maternity, and lastly, radiology. And so that's what is really kind of the focus of the bundled package. In terms of a little bit more granular information, with the product, in addition to and case management, we looked at pre-certification. And one of the things as a medical management company that we run into a lot is at renewal time. And a TPA contact, or maybe someone from the group, or reinsurance carrier saying, this member's had X amount, $60,000 in claims this year, or whatever the number might be. Show us your case management notes. Well, too often, we have clients that just focus on having us pre-certify inpatient admissions. And as you know, there are more and more procedures nowadays that can be done outpatient. Hysterectomies are being done outpatient, and gastric bypass surgeries are being done outpatient, et cetera. So if you're only focusing on having your medical management company pre-cert inpatient admissions, you're really kind of missing the boat on a lot of opportunities to get involved and impact that case, as well as having missed out on that opportunity to have someone case manage that particular case. So what we did with the bundle is we put together a recommended pre-cert list of all inpatient as well as outpatient procedures where we know we can make a difference. So I'll show you that in just a moment. We also built into the program pre-admission and post-discharge counseling. And so that's something new that we just created about a year and a half or so ago that I'll talk about that really is having a good impact on our customers' expenses. Advanced radiology scheduling services are part of this. Our transplant case management, as well as an additional transplant network that we're bringing to the table that can complement maybe some other relationships that you might already have. Integrated behavioral health, our oncology case management and negotiations, dialysis case management and various opportunities there as well to impact costs through different networks and negotiations. And then lastly, just really partnering with some other relationships that Cypress already has brought to the table, including Bridge Health. So starting out in utilization management, and I've got a lot of content, I'll be honest, that I want to cover this morning, so I'm going to try and just sort of cruise through some of these topics, but I want to make sure everyone has kind of the foundation for it and then understands what's included in the bundled package. But with our utilization management program, again, it is a URAC accredited program. We're using the Milliman guidelines as really our resource for medical necessity as well as for the length of stay. And we get a really good return on investment still with pre-cert. A lot of folks are thinking, oh, you don't save any money through pre-certification. It's really just a gateway to case management. That's not entirely true, though. There certainly are a lot of ways that you can save money within pre-certification, either identifying cases that procedures that just aren't even medically necessary. They really don't need to happen, or they don't need to happen inpatient. They could just as well be handled on an outpatient basis, as well as other negotiations, network steerage, getting someone out of the hospital sooner. All of those things really equate to some real savings with pre-certification. So again, with the Cypress bundle, we are including inpatient admissions as well as outpatient. And when we look at outpatient, we tend to put it into 4 categories: outpatient diagnostic, outpatient surgeries, continuing care services, and mental health substance abuse. For clients that want to go ahead and purchase this product, we really try to steer them towards this recommended pre-cert list. And this is really built on cases where either we know we can have an impact on the cost or the member's care. It may be through the pre-cert process that we're able to have those savings, or it may be an early alert for case management. These may be cases that we just want to get into case management immediately and really get involved with that member and with their providers and so forth. So we don't want members to jump through hoops that are unnecessary and aren't going to save any money. We really want to put together a list that's really impactful. And so we're constantly monitoring this list. But as you can see, there's about 7 outpatient surgeries that we know we can have an impact on. Includes things like back surgeries, gastric surgeries, hysterectomies, things like that. And a lot of different cosmetic or potentially cosmetic procedures are included on this list as well. It includes outpatient psychiatric and substance abuse treatment. A lot of changes with mental health parity a couple of years ago, so it's even more important now, I think, to really manage that type of treatment and manage those benefits as best we can. It includes outpatient diagnostic services, so MRIs, CAT scans, PET scans. We do more denials in that area than any other type of outpatient pre-cert. A lot of doctors have a shiny new MRI machine in their office, and they want to use it. They want to be able to pay for it. And so we are still seeing a lot of overutilization in the area of radiology. And then lastly, outpatient continuing care services. I always say to clients, if you're going to do one thing outpatient, what should it be? It should definitely be the chemotherapy radiation. There's a lot of issues that you run into there, a lot of complexity. It's the earliest way to find out that there's an oncology case that we're going to want to manage. Stop loss is going to expect it to be in management. So that is an absolute must. If there's nothing else that you change with your list, if you don't have chemotherapy and radiation, I'd highly recommend that. But this is really the list that we are recommending to clients as part of the bundled package, and it's built into the pricing and so forth. So moving on, pre-admission and post-discharge counseling. And this is actually a product that we created about 1.5 years ago for a large client that came on board and was really concerned about the readmission rate. They're having a lot of problems with people going in the hospital, having a surgery, going home, and ending right back up in the hospital again. And so we built this product to really meet that need, and it was really something that we felt was really appropriate for the Cypress bundle. Very first statistic, I think, says a lot. Preventable readmissions account for an estimated $25 billion in unnecessary spending. And it really relates to, if any of you have been in the hospital or been with a loved one when they've been discharged, it's pretty overwhelming. You're pretty much just waking up out of your anesthesia. You're finally able to maybe get out of bed, and they're telling you, okay, it's time for you to go home. They're rattling off a bunch of discharge plans. They don't even always write down their discharge plan, nor does it necessarily always make a lot of sense for a layperson. They're handing you a bunch of prescriptions and telling you good luck. And it's pretty overwhelming, and a lot gets lost kind of in that process. So that's really kind of the impetus for building out this product. The pre-admission counseling, what happens with that program is it's for anything that's scheduled, any scheduled hospital admissions. We go ahead and have a case manager reach out to that member and talk to them ahead of time about what to expect with that surgery. Do you know why you're having it? Do you know maybe there are other opportunities that they could have used first before they actually went right to that procedure even. So there might be other choices for that member. Do you know that when you get home, you're not going to be able to drive yourself home? You're going to need someone with you for the first couple of days because you're going to be really out of it. So helping them to plan ahead, to have someone there with them to take care of them. Might sound like common sense, but people don't always understand that. And so sometimes members end up in the hospital a day or two longer because they don't have that support system at home. So it's really helping them to think ahead of time about what to expect and planning ahead. And that can make a huge difference. In this little case example that I've got here, essentially by making that phone call, we were talking to the member, found out that she was going in for a surgery, for a colostomy surgery, and is on a blood thinner. And no one had talked to her yet about the fact that if you're on a blood thinner, you don't want to be taking that for a couple days or a day or two prior to having that surgery. No one had caught that yet. The doctor hadn't caught it, none of the nurses had caught it yet. So as a result of that conversation, we called that member's physician office and mentioned to them that this person's on a blood thinner, and they changed her drug regimen because of that. If we hadn't picked up on something simple like that, most likely she would have needed to have rescheduled her surgery, and they would have passed on costs related to that for that cancellation. The other program then is the post-discharge counseling, and really the purpose of this is to follow up with the member after they get back home from the hospital. So every single member, once they've been discharged from the hospital, we're going to have a case manager reach out to that member and just check in and see how are they doing. Do they understand those post-discharge plans? Do they get those medications filled? Do they know what they're for? Do they know how to take them? Maybe they're on a pain medication and have some concerns about that. Do they know what to watch out for in terms of an infection? Signs and symptoms of infections are something that we can teach them about, and oftentimes are picking up on issues through those conversations. And we can get the member to go back in and see their doctor rather than waiting until they have a full-blown infection and ending up back in the hospital again. So again, simple things like that can make a huge difference and really prevent that member from ending up back in the hospital. In this example, there was a 65-year-old male who went in for a knee replacement therapy. And again, by following up with that member, we were talking to him about the pain. He was having a lot of pain. We found out that he had symptoms of an infection, and we're able to go ahead, and our nurse called, coordinated for that member to go in and see their doctor, and got that infection taken care of with some simple antibiotics, rather than, again, if we hadn't made that phone call, probably ending up back in that hospital. Advanced radiology services. So radiology was one of the top issues that we're concerned about within the bundled product. And so in terms of radiology, what we've done here is, first of all, we want to include a pre-certification for any any outpatient radiology. So MRIs, CAT scans, PET scans, those types of things. We ask that we receive a phone call for pre-certification. We then look at that procedure that's being proposed to determine, is it really medically necessary? Do they really need to have that MRI done based on what their symptoms are? And again, we see more overutilization in this area than anywhere else. So we can save, $1,000, a couple $1,000 just by doing that pre-cert and finding cases that are not medically necessary. If it is medically necessary, then through a partnership that Cypress has with One Call Radiology, where we do the initial pre-certification, determine whether that radiology service really is appropriate or not. If it is, then we make a referral over to One Call, and they work with the member directly to find a freestanding radiology facility where that member could have their MRI done. And just by having it done at a freestanding facility, rather than the hospital setting where a lot of times they want to do those types of services, you can save up to 50% on the cost of that imaging service. So very, very impactful. And as you can see on the chart here and so forth, imaging costs have doubled since 2000. They're the fastest growing type of expense out there, and it's just continuing. The annual growth rate's about 7 to 12%. So that's continuing to be a problem that's really driving your claim costs. And through this type of service and through this partnership with One Call, we can really make a difference, weeding out those unmedically necessary services, and number two, getting them to the lowest level or lowest cost of care for that procedure. I want to talk about case management a little bit because obviously that's a real key to this program as well. And of all the products and services that we do, we get the greatest return on investment for case management than any other type of medical management cost containment product by far. On average, our case management return on investment is about 7 to 1. For our specialty case management, it's much, much higher, and I'll go through some of those numbers today as well. But again, we have a great group of case managers. I think we've got about 200 case managers. They're located all across the country, so they can cover the different time zones. They know the different hospitals and all the different regions, all the regions in which your members would be located, and that really makes a huge difference for us as well. And in terms of case management, it's really kind of twofold. Number one, they're working really closely with the member and with their family to really get them through that situation, educate them, help them find various resources, really help them to make the best use of their benefit plan. And then it's also working really closely with their providers to help coordinate that care. In terms of case management, I always say American Health, I think, is like, for me anyway, it's like the perfect size company. We're about 400 employees in total. We're big enough that we can have nurses that specialize in different areas. So we built out specialty units to be able to really focus on areas like oncology, transplant, neonates, high-risk pregnancies, dialysis, and mental health substance abuse. A lot of other companies just aren't big enough to have that, they just don't have enough volume to have those specialty units. So they have more medical, surgical, generalist type nurses handling these really complex cases. And again, if you really, if we can have nurses that specialize, it just has such a greater impact on their ability to manage that case, to really know the latest and greatest treatment in their particular field, and it makes a huge difference. So I said I think we're the right size company because we're big enough that we can have those specialty areas. We're small and nimble enough that we can customize for our customers, build out cool products like the bundled product that we're talking about today, and drilling it down even further into your particular group's needs too. So makes a big difference. In terms of our case managers and kind of their responsibilities, we kind of look at it in 4 areas. Assessment, so really looking at that case early on, talking to the member, talking to their family, really assessing that case and what the needs are for that particular member. Working on, in terms of care planning, developing an appropriate plan of care, looking at the plan of care that the doctor has recommended and comparing that to evidence-based guidelines and seeing, is that really the latest and greatest treatment? Might there be other types of treatment out there that are available? If not, we'll get one of our medical directors on the line and do a peer-to-peer review with that member's physician to make sure that we're all in alignment with what the right plan of care may be for that member. What's the most effective and what's the most cost-effective, and always having that balance between the two. And then monitoring the case, really collaborating with that member and with their provider team on that plan of care, and are they working towards and actually achieving the goals. And then lastly, evaluating it. So did we achieve our goals? Is this case under control? Is it time to close out the case, or do we need to still stay involved and kind of continue checking in and monitoring it? So now I want to kind of drill down into the other areas of the wheel. So looking at oncology case management. By far, we do more case management for oncology than any other area within our program. So we do about 4,000 cases a year, which is I think a lot. And so our oncology nurses have more than 10 years of experience. This is all they do. They specialize just in oncology case management. And so they're very, very good at what they do. The return on investment for oncology case management is about 8 to 1. And so the case manager gets really involved, again, with the family as well as with that provider in looking at that care. So doing a telephonic assessment of the case, educating the patient and their family. If they're going through chemotherapy or radiation, there's a lot of coordination there in terms of scheduling that appointment. They've got to get time away from work, perhaps, transportation, maybe other resources that are available to help support that member with their condition. So they get involved in really the whole kind of comprehensive aspect of it. I think one of the things that's unique about our program, and one of the things that I think it makes it a real kind of solid program, is the fact that, you know, when you're looking at oncology, again, it's very, very complex. And we run into this every day where a doctor, in a lot of cases, especially in rural areas, where the member is seeing a general practitioner or an internal medicine doctor who's trying to manage that member's oncology case. So in a lot of cases, they're kind of in over their head. They're not an expert in oncology, and so they'll recommend a treatment plan that either is not the latest and greatest in terms of effective treatments for that member, or they're recommending something that wouldn't even be covered by stop loss. And so what we've done is, number one, we only have oncology cases handled by an oncology case manager. That nurse will get involved in looking at that case, looking at what the plan of care is that's being requested by the member's provider, and comparing that to things like the NCCN guidelines, the National Cancer Institute guidelines, and other guidelines and resources that we have available to see, is this really the most appropriate plan of care for that member. Then that case is looked at by an oncology supervisor. So we have a second set of eyes look at that case to determine, did the nurse make the right decision? Is this really appropriate? Will this really be covered by stop loss? Should it go to stop loss? And then lastly, we have a lot of oncologists on within our medical director team and within our panel of physicians. And so we have an oncologist actually look at that case too. So it really gets 3 different levels of review just to make sure that, again, it's the right plan of care for the member, and again, that it's going to be covered by stop loss. And it gets pretty tricky, as you probably already know. They'll recommend usually a cocktail of drugs. It may be that each of those drugs individually, is FDA approved and is standardly covered, but you put that cocktail of drugs together for that particular type of cancer, and it may not be covered at all. So you really got to have someone that really knows what they're doing, and we're talking about, a treatment that's very, very expensive, hundreds of thousands of dollars. So you don't want a mistake made, and so we take it really, really seriously. This is something that we've recently developed that I think is important too. It's a sad situation when you're talking about end-of-life care, and it's very emotional and very difficult. And so we have nurses that are certified hospice and palliative nurses that really know how to kind of deal with those end-of-life care plans, if you will. You've probably heard the statistic, but I mean, more money is spent in that very last end of life part for that member than there was in the whole rest of their treatment. So you spend more in like the last 30 days than you did, maybe the year or two leading up to that. And so there's some tough decisions that have to be made there, getting into the quality of life for that member, and is what's more important, the quantity of life or the quality of life. So it gets really difficult. So we have nurses that really understand that and are able to talk to the group, talk with the family, and help them through that situation and making their own decisions about what's best for that member. So that's an important part of our oncology program as well. Moving into transplant, again, these don't come up every day, but when they come up, they're kind of a nightmare. I mean, they're very, very expensive, and transplants, the number of transplants just continue to rise every year. You can see in 2010, there were nearly 29,000 adults that received organ transplants, with the first-year costs ranging from $226,000 to almost $1 million. So very, very expensive. And currently, there's about 105,000 people waiting for organ transplants. Again, they don't come up every day, but they're very expensive when they do. And you need to have, I think, nurses that really specialize in that area to effectively manage that case and to help that family through that process. And so, again, we have case managers who have a strong background in transplants that are managing these cases. So I think we bring that to the table in terms of the specialty, but we're also bringing to the table an additional kind of tool for your tool chest, if you will, in terms of another network that's available through the Cofinity Institute of Excellence. So a lot of you probably already have a relationship with maybe a transplant network or maybe a couple of them. What we're able to do, our nurses are not only trained in case management, but they're trained at being able to look at different transplant contracts and understand them. And again, they get pretty tricky too in terms of, are there, the discount might look really good at face value, but what are the outliers? So what are the things that are not going to be covered under that transplant contract? Or what's the period of time that transplant contract or discount covers? So they're able to look at all those different pieces and really help to recommend which network has the best discount for this particular patient's transplant. And so this just really offers you one more, through the bundle package, we're able to bring this transplant network to you and just give one more opportunity to get a good discount for that particular transplant. And that's not to replace what you might already have available to you, but it's just one more option for you. Dialysis, that's another area with kind of the obesity epidemic, if you will, that we have going on in the country. We're all seeing, DaVita and Fresenius, but we're all seeing those types of dialysis centers pop up all over the country. And so with that comes, more and more costs, of course, to your plan because the number of people on dialysis is just continuing to rise. And so it is a problem that we all need to be, I think, prepared to handle and to address and manage to the best of our ability. So we have recently developed, again, another specialty unit in dialysis. So number one, we have nurses that are really specialized in dialysis and understand it and understand the different options that are available to members when they're looking at their dialysis treatment. And then secondly, we're bringing some partnerships to the table as well of ways that we can save money, either through negotiating with the dialysis center that the member is going to go to, getting them into a network. In some cases, and some plans are looking at even getting into Medicare Plus. So there's lots of different options out there. And so we bring different options to the table that we can work with you on for your particular cases that may come up and whatever options you might be most comfortable with. But it's not really a one-size-fits-all. In some cases, there's a network out there that has a great discount on dialysis for a certain maybe part of the country. In other cases, the discounts aren't so great, and the best way to bring down that cost is through negotiation. And so we really kind of look at it on a case-by-case basis in terms of what's our best opportunity to bring that cost down for that particular member. Moving into mental health then. We have partnered with a company called Curlink Healthcare, which is an EAP located in Chicago. And essentially what we've done is really partnered with them to have an integrated product rather than, a lot of times the EAP is kind of off in their own little silo and medical management's kind of over here doing their own thing and they don't necessarily talk and collaborate a whole lot. So what we've done with this program is we set it up where anytime a member is going to be seeking mental health substance abuse treatment, that call first goes over to Curlink. And Curlink has behavioral health specialists that answer the phone calls and do an assessment with that member to determine what are their needs? How complex is their situation? Is it something pretty acute where they may need to be hospitalized right away, or is it something that could be handled through outpatient counseling? So they do that initial assessment and make that determination. And about 70% of the time, it's actually something that could be handled through the EAP. So what's great about it is that they're able to increase the utilization of the EAP so that the member's not tapping into the medical plan unnecessarily. So it increases the EAP utilization. It also, therefore, increases the productivity and decreases the absenteeism to the plan as well if they're able to handle this through the EAP partnership. But for those cases that are more complex, rather than the member sort of delaying the treatment that they're going to need anyway, they immediately assign them to one of our case managers who then gets involved and helps that member get the right treatment immediately. So either get them inpatient or get them into extensive outpatient mental health treatment. So I think the partnership has been very effective for us in terms of, again, keeping members out of the plan that really don't need to tap into it and getting other members the right care immediately so that they're not delaying that treatment. And through Curlink, they are nationwide. They have a nationwide network of licensed physicians. We've also done some studies with them as well. And sliding over to this, some of the results of that are 51% of all mental health substance abuse cases are appropriate for this integrated behavioral health product. about 90% of those cases then they're able to resolve. So half the cases go to them, half the cases come over to American Health, and we assign a case manager. 90% of the cases that they are involved in are resolved, and we never actually see them. They never tap into the plan. So, and that results in really good savings. And the average outpatient counseling care cost is about $600. And we did a return on investment study for a group that was with the plan for about a year, and it was about a 1.3 to 1. Might not sound huge, but that's based on just the claim costs alone. There's also, again, the impact on productivity and absenteeism, which we're not able to measure. So I think it's probably much higher than that, probably more like a 2 to 1 ROI. But there are real significant savings with this type of arrangement. Maternity. Maternity was another area that we had listed kind of on the wheel, if you will, for the bundled product. And sort of like transplants, you don't have a premature baby every day, but when one does come across your plan, it's kind of a nightmare, right? They're very, very expensive. Now we see, $1 million, $2 million babies, very, very expensive. And so the focus here with the maternity management program is to find out about expectant moms early on, and typically it is that the mom is contacting us, letting us know that she's expecting. And then we have nurses that specialize in maternity management who do an assessment with that member and kind of learn about their particular situation. So have they had any past pregnancies? Have they had any miscarriages? Have they had a premature baby in the past? Do they have any chronic conditions, any lifestyle behavior issues that might impact them to deliver early? So find out as much as we possibly can about that expectant mom. And then we assign a nurse to work with her and to provide counseling. And so low-risk members we're contacting at least once every 6 weeks. Higher-risk moms we're contacting at least once every 3 weeks. But they really build a rapport with their maternity management nurse. In some cases, they build a stronger rapport with our nurse than they do with their own doctor, who, doctors are busy. The average office visit's about 6 minutes. So we have a lot more time to spend with them. And so as a result of that, they get pretty comfortable in sharing information with us, asking questions, and our nurses are really good at listening for things that might cause us concern that she might be at risk for delivering early. So our goal here is to just build a really close rapport with that expectant mom so we can help her deliver, a healthy baby in full term. So that's the goal. So we do the telephonic coaching. We also send out a lot of information to the mom. We have a book that we send on the pregnancy and the baby's first year of life, other specific information, whether it be about car seats or breastfeeding or nutritional type of questions that they might have. So all that is sent out to the mom. And then they also have access to the Strong Moms program where they can get baby organizer and coupons and all that kind of great stuff. But also if the mom at some point in time becomes the case becomes very complex, then we do put the mom into case management. We keep the same nurse for consistency purposes to continue to watch that case and help the mom through that particular situation. We recently did our return on investment study for our maternity management services as well, and so those statistics are listed here. But for the prenatal education program, our return on investment is 9 to 1. For the high-risk maternity case management, we're at a 33 to 1. I know it sounds crazy, but again, when you think about how much a premature baby costs, and you put that into the equation, the return on investment is pretty incredible. And then we also have nurses that, if we do have a premature baby, they have a background in managing those neonate cases. And so that return on investment is about 5 to 1. So I think pretty good results. We're really pleased to see that. The last area that I'm going to touch on is medical cost containment. And we have quite a few different options there as well. But one of the statistics I always like to share with clients is the first one, that basically 8 out of 10 hospitals have billing errors. I mean, that's terrible. 8 out of 10 have billing errors in them. And so it really makes sense, especially on those larger bills, and I'm talking bills of $20,000 perhaps and higher, rather than kind of letting them run through the system. And there's a lot of things that can be caught through claim editing systems and so forth. But some of those bills, the only way to really find out that those billing errors exist isn't something that a claim system could capture. It's something where you need to get that detailed hospital bill and really roll up your sleeves and go through line by line to see the types of things that they're charging for. And there's just a lot of kind of crazy charges out there where they're charging for things that don't even apply to the case, or they charge twice for something, or the medical record just doesn't even substantiate the need for a certain charge. So there's a lot of kind of mistakes out there. Some probably intentional, some probably just not intentional. But the only way to really find them is to dig through those bills and to look for those types of errors. And so we do, in terms of medical cost containment, first of all, we try to have really a consultative, I can say a consultative partnership with both the TPA and with the client. In some cases, it may be worthwhile to you to spend a little extra time and really go through that claim. In other cases, there might be reasons, a prompt pay discount or other reasons why you might want us to let the claim through that process. But we'll go ahead and we'll take a look at it ahead of time if you refer it to us and do a pre-screen review in which we're going to go ahead and look at the claim on kind of a cursory level and determine within a day or two whether this claim is a good candidate for finding you some claim and be able to save you some money essentially or not. One type of bill that we love to get our hands on is a back surgery. Back surgeries where there's implanted, screws and plates and this type of thing are ones where we always know we're going to be able to save some money. There's a lot of upcharging done on the different implantable devices. Other bills might come in and we say, we know from our experience we're not generally successful at saving money. Let's let that one slide through. So we can kind of work with you to consult with you on where it makes sense to spend the time and where it doesn't. The point check analysis is really where we're using bill audit and really, again, kind of rolling up our sleeves and looking for those charges where it's just not substantiated by the bill. And I'll share with you, oops, went a little too fast here. Our savings for that's about 40%. It takes about a week to be able to turn those claims around, but on average, our savings is about 40%. So pretty significant there. We can also do out-of-network negotiations and network repricing. And there, the average savings is 15 to 20%. Takes about a week or two to be able to turn those around. A lot of clients are surprised that we can have savings on network claims. And periodically there are network contracts that'll say that we can't, but unless that language is there, we can still look at the bill and they still can't charge you for services that were never rendered or just not appropriate for the case. We can't necessarily negotiate on the cost of the services that are substantiated, but they can't expect you to take a discount off of something that really wasn't not even performed or not appropriate to that case. So there definitely is an opportunity to bring down the cost of a claim for both network claims and out-of-network claims. A couple little case studies that we did here. First of all, there's a hospital bill for $302,000 that was sent to us. It was out-of-network, so there was no contract agreement at all. What we did is we went ahead and compared that bill to other bills for the same type of service that were done through a contracted rate and used that as sort of our leverage. And we're able to bring that cost down by $106,000. Another example is an outpatient claim with pharmaceutical charges of $174,000 that had a PPO discount of just 10%. Pretty menial, right? 10%. And so we got on the phone with that particular provider and were able to get just a single case agreement. So we got them to negotiate with us just on that particular case, and we were able to bring the claim down by another $66,000. So certainly is worth the time and the effort to slow down some of those claims and take an extra look, make a few phone calls here and there, and you'd be amazed at what you can do in terms of the savings. And some of the bill error reviews that we're doing, we're getting about a 15% discount on those. Reasonable and customary. An example might be the back surgery that I mentioned, calling up perhaps Medtronic or Boston Scientific and finding out what did that plate cost or what do those screws in the back surgery cost or whatever, and then allowing a reasonable markup to that. We can have significant savings there. Our average is about 31%. And that's it. So that's pretty comprehensive, right? I know I kind of blew through that pretty quickly, but I at least wanted to get you familiar with the package that we've put together. For any of you out there who are currently an American Health customer, first of all, let me thank you. Hopefully this is something that you might be interested in taking a look at, and so certainly if you are and you want to transition from your current arrangement to the bundle, we'd be happy to talk to you about that. If you're not with American Health, hopefully I gave you something to think about in terms of our capabilities and our services, and I would just encourage any of you to go ahead and talk to your Cypress sales or account executive about it further. So with that said, thank you for your time.
Thanks, Carrie.